talk about an infectious disease in the udder known as mastitis. It's one of the most prevalent diseases in dairy cattle, and we'll be using a cow-side test known as the California Mastitis Test, or the CMT, to diagnose mastitis in one of the four quarters, or parts of the udder of a cow. Mastitis can be classified as clinical or subclinical disease. So subclinical would mean that there are no visual abnormal changes to the cow or the milk. So it would be diagnosed using the somatic cell count in the milk itself, so quantitatively. Whereas clinical mastitis, there are visual signs of the disease, including it could be redness or inflammation of the udder, pain, swelling, and abnormal milk. So there may be flakes, chunks, or abnormal color of the milk as well. So here I have everything I need to perform a CMT on this cow here. This is the CMT solution. It comes as a concentrate and then it's diluted. And this is the paddle, and it's designed to go under the cow and allow you to know which cup allots to which quarter of the cow's udder. So this will be the front left quarter, the front right quarter, the rear left, and the rear right quarter. The CMT contains a detergent which will react with the DNA of the somatic cells present in the milk. And as there's an increasing number of somatic cells, which indicates an infection, then we'll see an increasing amount of gelling in the solution in each cup. So on a daily basis, when the cows are milked, the milker can check for signs for clinical mastitis. So here we have the cow 5058, and we can look at her udder and check for redness or swelling, which I don't see any abnormal redness or swelling here. And then you can take the initial strips of milk. So the first few strips of milk are not fresh milk, so we want to take a couple strips out first, and then we can look at if there are any abnormal signs in the milk, which this one looks okay. And then her front left quarter, you can see that there were chunks. Might have been just in the first strip. Equal amounts of milk in each of the 4 cups of my paddle. And now I'm going to add an equal amount of the CMT solution to each of the 4 cups. So you can see this one here. Okay, so as you guys saw, 5058 showed mastitis in 2 of the 4 quarters that we tested. But as we stripped the milk, only 1 quarter showed clinical signs of mastitis. Can you identify the quarter that had subclinical mastitis and describe the inflammation process occurring in each of those quarters? So there are, let me try it again. Oh, jeez, scared me.
You're gonna have to get this part. Okay. Hi.
Oh, they don't like me anymore.
They don't like you.